Please join me in welcoming Daniel Bowles.
So, Dr. Beyer said my name's Dan Bowles. I'm very delighted to be here and see so many interested faces out there. So I'm a medical oncologist. I guess my only disclaimer is that I work for the University of Colorado, but my main employer is the Department of Veterans Affairs. So we all know how the federal government feels about this particular topic. So my topic here today is, since I'm mostly speaking with public health folks, is not to talk about marijuana as it might be used for symptom palliation or potentially anti-cancer properties, but I think more to think about what do we know about marijuana usage and cancer risks. And I think the big question that everyone has is this, right? Is the Marlboro Man the same as Bob Marley? So you can't go to a lecture from an oncologist without having this slide come up at least once. So basically this tries an idea of cancer incidence in the United States. This is from the American Cancer Society. Anyone can pull it up online, both for cancer death and then for cancer incidence overall. And I've highlighted a couple of what we think of as smoking-related malignancies, because I think that's mostly what people are worried about when they think about marijuana use. So you can see, lung cancer is common in men and women. It's the #1 cancer killer in men and women in the United States and worldwide. And then I've also highlighted something, oral cavity cancers, which we'll hear a little bit more about. So one thing that we, I think, had set up very nicely. Oh. Is this better? Okay. So one thing that I think we need to do, and we heard from our last speaker, is we really need to separate a couple of different products. So there are the cannabinoids, the chemicals that are basically in the marijuana plant, and then mostly what I'll talk about is cannabis smoke. When people do these kinds of research, what they'll do is they'll actually light the plant or joints or what have you, and then they'll condense the smoke and use that. So one thing that we think about when determining whether something is potentially carcinogenic is, well, what does it do in experimental models? So there are two big ways that people do this. So there's something called the Ames test, which basically uses a bacterial system to see whether you can induce mutagenesis or mutations in the DNA that would be carcinogenic. And then there's something else that we do where you apply some sort of toxin to an animal's skin and see whether you create a cancer. So when you do this, something interesting happens. So with the Ames test, that's the bacterial test. If you use any number of different cannabinoids, be it THC or cannabidiol or the ones that CBD, the ones that have mostly been tested, they don't appear to be carcinogenic either in bacteria or when you apply them to mice. That's very different from cannabis smoke, where if you actually apply it to these bacteria, you apply it to rats, you can induce precancerous or cancerous changes. So there's a big difference between the two. So I'm going to focus then on cannabis smoke because I think that's where there's more interest. If you look at cannabis smoke itself, again, have any of you seen public health officials, the processes where joints or cigarettes are smoked, that smoke is condensed and then analyzed chemically. What you'll find is that there are a lot of similar carcinogens in terms of not necessarily percentages, but in terms of actual chemicals between cigarette smoke and marijuana smoke. Per joint unit, joint versus cigarette, there's often more tar in marijuana preparations than there are in tobacco preparations. So there's some indication that at least there are toxins in these, particularly if they're smoked. This does not apply to edibles. There's actually basically no research on edibles or topicals for this particular topic. One thing that has been done, though, is people have looked at the airways of people who are chronic marijuana users and tried to figure out, well, are there any changes in the cells that could potentially lead to cancer? So, again, you can't go to a talk from an oncologist without having a picture of some tissues. So what you'll see on the one to your left is it looks fairly organized. It's, you don't have to be a pathologist to know it kind of looks okay. This compares to the one right next to it that looks got a little bit more disorganized. It's got big white globs in it. And those are basically precancerous changes that you can see in respiratory mucosa of some chronic marijuana users. Now, that said, there are lots of precancerous changes that never turn into actual cancer. So it's an indication that there might be something going on, but nothing definitive. So let's talk a little bit about lung cancer development. So, number one cancer killer in the United States. And I'll tell you, I think the studies have really been a mixed bag in terms of whether it's good, bad, or otherwise. So here is a summary of a couple of studies that came out over the last decade or so that have really said, well, we don't think it's a risk factor at all for lung cancer development, or it is a risk factor. So the top two, Hishibi and Meira, took slightly different methodologies. One was a systematic review. One was more of a classical case control study. This one was from the ENHANCE Consortium, which is throughout the United States and Latin America. And what they found is either there was no clear evidence that marijuana usage was associated with lung cancer development, or in one situation that had a non-significant protective effect. This contrasts with two studies, one from the UK and one from North Africa, that did find that there was an increase in there was an increase in lung cancer development in people who used marijuana frequently, and then it might be dose dependent. The more you smoked, the higher the risks. The studies, though, had variable amounts of information with regards to a big confounder, right, tobacco use. So only the Aldington study really, when adjusted for tobacco use, said maybe there's still a signal that there's increased risk for lung cancer development. So I want to take a little bit to focus on one of the studies that's in your annotated bibliography, because I think it's the biggest study to date to really look at this issue. So I'll call it the Swedish military study. So basically what it is men who were conscripted into the Swedish military in 1969 and 1970 were assessed for a number of different baseline health factors, substance use, et cetera, alcohol, tobacco, marijuana. There's about 50,000 men, slice in time, and they were followed until 2009. So what did they find? Well, I think you can see here that one poor soul developed lung cancer in 1979. He was probably in his late 20s, early 30s. As you'll see, the cancer incidence peaks about 30 years, 40 years after people enlisted in the military. That seems about right for when lung cancer develops in most people. And what you'll see in that bar graph is most of these people are in the section of the clear portions of the bar graph were non-marijuana smokers. But there were certainly an escalating number of people who had ever used marijuana or were frequent users who developed lung cancer down the road. Well, great. We know that people who smoke marijuana are often have higher rates of alcohol use, tobacco use. So how can we separate one versus the other? So what these researchers did when they took the initial intake, they tried to figure out, again, these were 18 and 20-year-old men who were conscripted, 18 to 20-year-old men who were conscripted. How much marijuana did you smoke? Have you done it once? Have you done it 10 times? Have you done it more than 50 times? And what they found, I'll highlight here in red, was that when you adjust for tobacco use and some other factors in terms of socioeconomics, alcohol use, and some other known risk factors for lung cancer development, the people who had smoked the most prior to age 18 to 20 had a statistically significant increased risk of lung cancer, a hazard ratio about 2.1. So not a huge risk, but an increased risk in this study. Now, just by way of contrast, it's not exactly comparing apples to apples and apples. It's more like apples and pluots or something. When you look at lung cancer development in cigarette smokers, non-adjusted, the hazard ratios are more on the order of somewhere between 2 and 5, depending on how you smoked. So again, a suggestion that there might be something increased risk maybe with the highest smokers. Lower usage rates didn't seem to be clearly associated with lung cancer development. But there are a couple of big confounders. So one is that this is just a slice in time, right? This is looking at 18 to 20-year-old guys. What'd you do in the preceding decade? Well, we have no idea how their tobacco use changed over time. We have no idea how their marijuana use changed over time or anything else. If you look, I work for the VA. If you look at the military, the people who smoke in the military right now in the United States, 30% of the smokers in the military right now took up smoking in the military. So I have no idea how many of these guys were non-smokers when they enlisted or when they were conscripted and then became smokers. But I do think it gives us an idea that maybe there's a signal that's worth investigating further. So I'm mostly a head and neck cancer specialist, so this is an area clearly smoking-related malignancy. Let's talk about that for a moment. So known risk factors for head and neck cancers: tobacco, alcohol, human papillomavirus, the same thing that causes cervical cancer, is actually the leading cause of oropharynx cancers at this point. And as with lung cancer, the studies have been mixed thus far. So I would take a moment or two to talk about this study. It's also in your annotated bibliography. It's from this consortium called the ENHANCE Consortium that actually involved Europe, North America, and Latin America. But for this study, I actually just looked at the US and Latin American sites. So they ended up having about 2,000 patients with oropharynx or oral tongue cancers. For those of you who don't think about this stuff all the time, the oropharynx is basically your tonsils in the back of your tongue where it no longer flops around in your mouth. And then the oral tongue is the part that actually moves when you speak. So they looked at these sites in the U.S. and Latin America, and depending on the site, some of them were were much more retrospective in nature, and some of them were a little bit more prospective in nature. So this one looks great up there. It looks tiny up there, but it points out a couple of things. So this is for just oropharynx cancers, again, the tonsils and the base of the tongue. If you look, they'll say if you'd ever used marijuana versus never used marijuana, very dichotomous distribution, there's an increased risk of cancer development. If you then scroll down and look to see, well, is it associated with the dose, how much people smoke, it does appear to be associated in that the people who had the highest amount of marijuana usage had the highest risk in the study of developing oropharynx cancers. This is a forest plot, and the way that to read these is basically anything towards me of the line suggests that there's a higher rate of cancer development in people who've used marijuana, and everything to the other side suggests there's a lower risk. And there's something really interesting that happens. When you look at oropharynx cancers, there's a higher risk of cancer development in people who'd ever used marijuana. If you look at oral tongue cancers, it actually appeared to be protective. Well, why the heck is this? It's all respiratory mucosa. It's all exposed to the same toxins, one would think. Potential toxins, why could that be? Well, it's interesting. I think we have some thoughts, but nothing definitive. So, for oropharynx cancers, it did appear to increase the risk of cancer development in this study. For oral tongue cancers, it appeared to decrease the risk. It was dose-dependent, and whenever you're looking at cancer development, you want to look to see if it's dose-dependent. The more toxins that there are, the higher risks you should have. But if you'll remember, I said that HPV, or human papillomavirus, is a risk factor for oropharynx cancer. It's the major risk factor for oropharynx cancers. And we know that marijuana usage is associated with more risky sexual behavior, at least more sexual partners. So one wonders if it actually is not the marijuana itself in terms of a toxin or a chemical there, but it's in fact more an indication of sexual practices in people who use marijuana that's associated with the increase in oropharynx cancer risk. And the last one I'll talk about is going to be germ cell cancers. There's kind of emerging information of testicular cancer and whether there are risks associated with marijuana use here. So, for testicular cancer, the major risk factor is having an undistended testicle or cryptorchidism. Some theoretical risks are if you have excess estrogen for whatever reason. We know that marijuana can be associated with gynecomastia, that's the development of breast tissue in men, which is usually an estrogenic kind of phenomenon. So there have been a couple of studies that looked at this, and I'll focus on just one. So there's a study of patients with testicular cancer from Los Angeles in the late 80s, early 90s. It took 169 guys. They had a cohort of about 200, but when they actually had sufficient information on all of them, it was about 169 people. And then they had age-matched controls based upon age, neighborhood, et cetera. And what they found is there are two main types when you look under a microscope of testicular cancer. There's something called a seminoma, which are exceedingly curable in almost everybody, even when they've spread. And then you have non-seminomas, which are slightly more aggressive. So for seminomas, there was no risk at all. It was straight down the line, relative risks identical, whether they were marijuana users or non-marijuana users. For people who had non-seminoma germ cell cancers, there did appear to be a higher risk, about 2.1, for people who had ever used marijuana. What I think is interesting is, in contrast to the head and neck cancer data, it did not appear to be dose-dependent. And one of the things that's interesting is that people who were former users at the time of this study, all these patients were 18 to 35 years old. So people who were former users actually had higher risks than the people who were current users. Now, why in the universe might that be? Well, you have some theories. One might be that people, if this is a kind of a developmental phenomenon, when people are coming to sexual maturity, maybe if you use marijuana earlier in that developmental process, that's the higher risk time. By the time those guys were 25 and became married, and who knows, their wives told them no longer to quit smoking, and that risk had, that the marijuana usage had passed, but the risk had been laid forth. We don't know. There have been 2 studies looking at this, and the data are fairly consistent in terms of seminomas versus non-seminomas, but I think the mechanisms are unclear. There have been a couple of other epidemiologic studies that have looked at global cancer risk. Both of them actually are through Kaiser in California. They basically surveyed their members to look at everything, and they could find no real increase in colorectal, melanoma, or breast cancer. Maybe some suggestions that there is an increased risk of prostate, cervical, or brain cancer. Those are gliomas. But one of the big caveats for these studies is most of the people they looked at were in their mid-40s, and the peak of cancer development is certainly not in the 40s. So I hope that I've at least piqued your interest and gotten you thinking about this a little bit. I think there are preclinical data supporting that cannabis smoke can be potentially carcinogenic or mutagenic, and that people who smoke marijuana regularly might have a higher risk of precancerous changes in their respiratory mucosa. I think with regards to cancer, there are some bigger, better done epidemiologic studies suggesting that there might be a higher risk of lung cancer or pharynx cancer, and maybe germ cell cancers, but not seminomas, not oral tongue cancers, and then it's really a mishmash in terms of other stuff. So I think that's all I've got. I'm happy to take questions.
Great, thank you. Any questions from the panel? Yeah, Chris.
Thanks for that presentation. I have a quick question. From a cancer standpoint, should vaporization of tobacco, marijuana be considered safe, or are there still potential carcinogens in vaporized?
So I think that there are, again, it's all a matter of percents. So I think that there have been some studies to look at vaporization versus smoking in terms of medical marijuana and efficacy. In terms of toxicology studies, I'm not aware of many that have been done. So I don't think we know. And I think, it's a moving target, certainly, in the world of e-cigarettes versus conventional cigarettes. I think there are emerging data to say that they have many of the same potential problems. So I don't think we can know, but I think it's something that needs to be evaluated.
I do know of a study that looked at the particulates in vapor. I can send it to you if you.
No.
Other questions?
Actually, I had the same
Yes.
question.
Oh, it was the same question.
Yeah.
Well, like I said, if you look at these epidemiologic studies, they're cohorts that came from the 60s, 70s, 80s, and 90s. It's not exactly, and it was people who were using it recreationally predominantly. So I don't think vaporization was an issue there.
One more question.
So given that we are seeing rising amounts of THC in cannabis, and given that the danger seems to be the smoke or the ingesting, do you think that the higher THC percentages, if people are now smoking 1 joint versus 3 joints because they're stronger, that actually may be a way to curtail the impact of the smoke?
I think it's theoretically possible, because there's nothing to say consistently that THC or cannabidiol is carcinogenic. In fact, there's some interesting studies we can talk about at another time that suggesting they have some anti-cancer properties. So I think that if the goal is to decrease all the bystanders of smoking, something that has people smoke less would probably be beneficial.
Thanks.